Okay, welcome everybody. It's nice to have you here today, and I'm so excited for this conversation with Rachel Lewis about secondary infertility. So I'm going to start by introducing Rachel. And Rachel is the author of the book Unexpecting, Real Talk on Pregnancy Loss that came out last year in 2021. She is the founder of Brave Mamas, an online community offering support to thousands of bereaved mothers. She's also a well-known contributor to Still Standing magazine and Pregnancy After Loss Support. Her work and family have been featured by The Today Show, Upworthy, Adopt US Kids, and Babbel. Rachel has experienced the loss of 5 pregnancies, as well as the unique grief of reunifying a foster son with his birth family. So Rachel is here to share about her experience, as well as the experiences of so many other parents that she's worked with who have experienced secondary infertility. And it's something we don't hear a lot about until you kind of start opening up the conversation. And I know that it can be a common thing that people are going through. So Rachel, thank you again so much for being here. And let's go ahead and get started.
Thank you, Kylie. I really appreciate that. Like Kylie said, I am the author of Unexpecting. And before I share my screen and we get into the webinar, just a little short snippet of my story. When I got pregnant for the very first time, it was, to be perfectly honest, it was on accident, wasn't expected. And I remember sort of thinking like, oh, like, I guess I'm never going to deal with infertility, right? Like that's never going to be a piece of my story. And we had a very complicated pregnancy, but it did result in a live birth and a living daughter. And after that, the next time I became pregnant, that was a ectopic pregnancy, and I had my fallopian tube tore, and I was sent off to emergency surgery. And of course, I did lose my baby, and that was my first of, as Kylie said, 5 back-to-back pregnancy losses over 5 years. And as you can imagine, during that time, my focus very much was on pregnancy and fertility. I had to see a reproductive endocrinologist. I had lots of invasive testing done. And they could never figure out why I could not carry I was struggling to carry to viability. And so it was a very difficult, very lonely season in my life, and one that was really unexpected. And I think all of us, like when we're hit with that just sort of unexpected part of our fertility journey and the reproductive trauma that comes along with it, it can really shake our world and shake our own self-identity and our own interaction with other people in our relationships. So I think that today's topic is really important just because we're shedding light on some of the parts of infertility that we just don't talk about very often. And I think we just really need to sort of bring that out into the open. So if you guys have questions, we're going to do a question and answer at the end, but I would just encourage you to go ahead and put that question in the comment box as it comes up. Don't feel like you need to wait to put it in the comment box till the end. And then we can hopefully go over those questions there at the end. So so feel free to do that. I'm going to share my screen here and hopefully get this presentation started here in just a minute. So
yeah, and it seems that the chat box was disabled, which I've never seen before, so I fixed it.
Oh, okay.
So that is why nothing was happening. So
okay.
Apologies, everybody.
That makes sense. Okay. This is going to take me just a second to get here. Okay. Is it showing okay? Everybody can see? Does that look okay, Kylie? Okay. All right. So secondary infertility isn't secondary. The reason I titled this is because one, it often isn't talked about like primary infertility is. And second, because a lot of people will say, well, at least you've had a child, or at least you know you can get pregnant, or at least you've been pregnant before. And so even there can be a lot of dismissive things that are said, even when you have perinatal loss and you don't have living children. There can still be a lot of just dismissiveness. And so I just want to reiterate, like, your experiences are not secondary. They are valid and they are important. Okay, as I said, when I first became uh, pregnant, I thought, okay, this is it. I'm never going to struggle with this because I had never heard of secondary infertility. And I pulled this quote here from my book. So, like many of my sisters struggling with secondary infertility, I had assumed that getting pregnant easily the first time meant that I had captured the holy grail of family planning, that I was an infertile mom, a living, walking, breathing contradiction. And that's often how I felt as I was parenting my living daughter, as I felt like I didn't know how to embrace these roles that I was given simultaneously of being a mother to a living child and simultaneously trying to um, grow our family and not having any control over that. So I know that this experience may look a little different. So we're going to talk about that in just a second. So, what is secondary infertility? It is a rarely discussed condition in which a person gives birth at least once and then struggles to conceive or carry their next baby to term or to viability. And this is, this seems like a very black and white definition, but there's a lot of nuance to these experiences of secondary infertility. So some families are going to have secondary infertility and they will have already had living children. Or they will, have go through infertility, have a child, and then go through infertility again. Some families have experienced perinatal loss and they go through this experience with no living children, or they may end their sort of fertility journey with no living children. Some people are able to get pregnant easily, but they have repeated pregnancy loss. So they're constantly going through this cycle of being pregnant and then not being pregnant. Other people require years of medication and tests and invasive procedures and invasive testing just to fall pregnant. And sometimes they will also have repeated pregnancy loss. And sometimes it's just a matter of getting pregnant. And then their body is able to carry that baby to viability. So, what this means is that each of our experiences and what we're bringing to secondary infertility and how secondary infertility impacts us is going to be really unique and it's highly nuanced. Um, so, even though as I'm speaking, I'm talking, generally about secondary infertility, I just want to highlight that my experience is my experience and your experience is your experience. And even if they look different, um, even if our family composition looks different, um, your struggle with infertility and all your feelings about it are valid and worthy of support, no matter what it looks like to other people. So, infertility is not, I think we've all heard the term pain Olympics. It is not this, well, at least you can fall pregnant. Or at least you have a living daughter while you're going through it. So this is not how we want to approach us today, because I think all of us can agree that's not helpful. But what is helpful is to recognize what are the nuances to our own unique situations, how is that impacting us, and trying to work through that. I really loved this quote about reproductive trauma. So infertility, including secondary infertility, is considered a reproductive trauma. And I really think that it's important that we understand the impact that that has on us as people in our relationships, in our own relationship to ourselves and our mental health. So it is not simply a disappointment. It's not simply a lack of control over one's life. It is considered a trauma. Uh, this quote here says, think about infertility as an event that causes the disintegration, not just of a would-be pregnancy, but of one's entire world. It affects every aspect of one's life: feelings about the self, questions about one's purpose, concerns about relationships with one's partners, friends, and the world. Sorry, family and the world, and worries about the future. How does and will one fit in? What is one's legacy? What is the meaning of one's life? These are clearly not minor concerns. Trauma in general can be thought of as an event that overwhelmingly shatters core beliefs and assumptions. For reproductive patients, the narrative that they once held, often as an unconscious guideline for the creation of their family, is no longer tenable as originally imagined. The core assumptions they held about having a family are demolished. And that quote is from Janet Jaffe from Trauma and the Reproductive Story. In the chat box, I just would encourage each of you to be like thinking, okay, as I shared that definition, what pieces of that stood out to you? Does it encourage you to think of your own infertility journey and story differently? And what part of that trauma, like of the narrative, of just having your whole worldview can shift? Like what piece of that resonates with you? So I would encourage you, if you are comfortable, to go ahead and share that piece in the chat box of what resonated with you. I wanted to share in my own words what going through secondary infertility felt like for 5 years, getting pregnant again and again and having repeated losses. So this is something I had written in my book, and I just wanted to share with you. Every moment I wasn't pregnant felt wrong. My womb, my heart, my arms, everything felt hollow. I desperately wanted to be pregnant again, but I was terrified of it. I didn't want another baby. I wanted Olivia, and that was my ectopic baby. The 3 months I had to wait before trying again was an eternity. Sex made me cry. I was always thinking 9 months ahead to a potential due date. I have to get pregnant this month or we missed Christmas, I'd think. I was upset any time that potential due date fell in the following year. Every month and year that passed felt like failure. The 2-week wait was a unique torture. Every symptom drove me to Google, which only assured me that I might be pregnant. Not helpful. What I needed was for it to say, you are pregnant. Your HCG and your progesterone are normal. Your baby is healthy. Your pregnancy will be complication-free. You will deliver exactly at 40 weeks, and both you and baby will be perfectly fine. Everything will be fine. I mean, that's not so much to ask, is it? My first negative test made me cry like I'd lost another baby. I hated my period. Life was divided by the 2-week wait to test and then the 2-week wait to try again. Pregnancy consumed my thoughts. Can you tell? Repeat, repeat, repeat. If you were to put your infertility journey into words, what are some of the words that come to mind for you? What are some of those experiences that that feel, they're hard and they're painful, and maybe they're things that we don't often talk about? So feel free to just add that into the chat. Today, we wanted to talk about the unique challenges of secondary infertility and the reproductive trauma that accompanies it. So we're briefly going to go over your roles and interactions in society, how that's affected, your parenting if you end up with living children, either before or after, your physical health as you try to conceive, your relationship with your partner, your relationship with yourself, and your mental health. So let's talk briefly here about the strain of our interactions with society. How does secondary of infertility affect that? The first is you may appear childless. And people often assume that if you are childless, appear childless, then that is by choice. We don't often acknowledge that infertility, or like, we don't have control, because honestly, in our culture, we value control so much, and we believe that we have control over our destinies and over our futures. And if you just try hard enough, if you just stay positive, if you just, whatever, then you will have control. And we often elevate people who try even past their boundaries, to get what they want, right? So our culture doesn't necessarily embrace healthy boundaries. It really just believes that if you just try hard enough, you can have what you want. So this can be really hard to sort of, because your life really is going to challenge that philosophy that actually no. Unfortunately, there is a huge loss of control that comes with infertility. And people will maybe give you dismissive comments like, oh, you're so lucky you don't have kids at home because you can go out whenever you want. You don't have to pay for babysitters. So they can say some really awful things. And you can receive those comments often because people are just not aware that you may appear childless, and you may have had repeated loss, or an infant loss or stillbirth or miscarriage, and this is not by choice. So that's a difficult. People may ask intrusive questions like, oh, well, when are you going to try again? Or if you have living children, they may say like, oh, Bobby definitely needs to be an older sibling by now. When are you going to get on it? So that can also be really hard to handle. People often assume once you get pregnant that you are easily fertile. So because we don't talk about secondary infertility often, there's just a lack of awareness that this is a condition that happens. It can your relationships with, I call them the fertiles. This can be friends, family members, coworkers. These are people that, or even, on social media. Now that we have social media, that is really hard, because now you're not just exposed to the people who are fertile and pregnant, that are just like in your little world or in your bubble. Like it's all the people that you've ever known that you wanted to stay in contact with, who are able to post, pictures on Facebook and that kind of thing. So you're getting triggered time and time and time again, and you're having to figure out how to set those healthy boundaries to protect yourself, while at the same time maintaining the relationships that are important to you. So that is a very, very real stress. And we're going to talk about boundaries in a minute, but I just wanted to acknowledge this is hard. Faith, where do you fit? For some people, if you have a faith, it can be challenged. It can feel like, what am I trying to say? Like, the word I used to describe my experience was spiritual whiplash, because I had maybe expected that, kind of like, if I just did all the right things, if I scratched God's back, he would scratch mine, kind of thing. Like if I was a good enough person, if I prayed enough, that somehow I would be spared, and my children, and my babies would be spared. And I don't know where I got that or why I thought that, but it didn't really occur to me that I felt that way until I prayed so desperately for these babies, and I kept having miscarriages. And so you may experience a faith shift And when you're going through, as we're talking about, a trauma that can shift and shape your worldview, uh, it's understandable if your faith falls into that equation. And I want to encourage you to listen to that and to not judge that. If you have a faith, there are times where people may encourage you to, just you have to just stick with your faith. Don't doubt, don't have questions, no matter what. And I want to just give you permission to say it is okay if your faith changes. It is okay if you need to just not go to church for a while or a long time because it's too triggering, that kind of thing. So, all right, the next one is ambiguous loss and complicated grief in a society that lacks grief literacy. So let's talk about that real quick. Ambiguous loss is a loss in which it's hard to define exactly what was lost. And I think there's parts of there's ambiguity in any of our losses. There's times that we're not going to know exactly what we missed out on. But with the loss of a pregnancy or the loss of our fertility, there is this element of we did not get to know our baby. We did not get to know who they were, who they might have been. And there's also it's difficult because if you either cannot get pregnant, or if you're losing embryos, maybe you've had some embryos implanted and they don't stick. There's that sense of like, am I grieving a person? Am I grieving my fertility? What is the value here in a society that doesn't always value pregnancies and like with equally. So there's that ambiguity that we have to sort of wrestle with, and then the complicated grief that goes with it. So that is really hard, especially in a culture that is telling you constantly to either let go and move on or just try hard enough, and not allowing you to really feel and really mourn what this infertility is meaning to you, and what it is costing you, and the sacrifices that you are making. There's a lack of understanding even within the infertile community. And this is hard, right? Because belonging is such a need. It's something that we just absolutely need to have in order to heal from our trauma, in order to feel safe, is to have that belonging. And so when you're in the infertility community, you can experience the dismissiveness, as we've talked about, where primary infertility is kind of seen as the more traumatic version, and secondary infertility is sometimes seen as like, well, at least you can get pregnant. I can't even do that. Within the baby loss community, you could also struggle if you've had a loss and you are trying again, and you're seeing other people have their rainbow babies, and there's this huge kind of idea within the baby loss community that a rainbow baby is like this ultimate healing that one can have. And so as you're in your support groups and you're watching people have their rainbow babies, there can be this feeling or this pressure and this deep grief. If that is what you're desiring, is to have a baby, and you're watching other people do it. And then also just that feeling of being left behind. Like, why me? Why can't I have a rainbow baby? Why can't I get pregnant again? It's really, really hard. And then there's just this pressure that we face. And the pressure, it kind of feels like a pressure cooker, right? This whole infertility, this infertility journey. So, okay, grief. In order to heal, grief needs to be validated. It needs to be shared. It needs to be supported, understood, and accepted. And for many of us, This simply does not happen. So this is a real challenge when we are going through infertility and our community is unable to validate, allow us to share, for them to support us, understand us, and accept our grief and our infertility for exactly what it is. All right, let's talk briefly about the pressure that it puts on with you and your partner. Um, One of the struggles you may face is having a different idea of when it's time to stop trying to have a baby. And this can really be a challenge because as the woman or the partner who is having the child, or trying to have the child, or going through the infertility treatments, that can be, you can feel like, okay, but this is my, this is my body. Like, yes, this is our partnership and this is what we're trying to do as a family, but this is my body. And or your partner maybe going through the infertility treatments, and it's hard to feel like sort of this lack of control, and this lack of being able to solve the problem. So there's these differing ideas, and as a partnership, trying to communicate those in a really highly emotional environment is hard, right? So that's where a therapist can help. um, trying, if you need help, trying to figure out, okay, where are our boundaries as we're going through this. There's the pressure of trying again, right? I mean, I don't want to assume, but I know I've definitely texted my husband like, "Hey, so I took the ovulation thing, and you need to come home today, and we need to have sex." So there's a smiley face on my ovulation kit. So there's this pressure of like, okay, well, we need to have sex like right now, or we need to go to this medical appointment. You need to go with me. Um, and it changes the dynamic of our relationship in many regards. And it just puts this additional pressure. There's a tendency that we can have to get tunnel vision in our relationship. And that's something that's it's just hard, right? Like when we want something so badly and when it's affecting every part of our life, it's really easy to just have our vision and our focus in our life to narrow, to only be able to see through the lens of like our fertility. And so um that can be really hard to realize, like, okay, making sure that your relationship and your partnership doesn't just become about having a baby, and that you continue to invest in your partnership outside of the fertility piece of it. It can be hard to understand, empathize, or meet differing needs. There's going to be times where, with your partner, one of you needs to keep going. You feel this drive to go to the next treatment, and one of you needs a break, right? And so, or one of you is feeling grief, and you deeply need to demonstrate that, and you need to be seen and validated in that. And perhaps one of you desperately needs to be distracted, needs to take, needs to be internal about their feelings about it, and doesn't want to share it. And so balancing those different needs can be difficult. A man's experience, or I'm going to, include also partner's experience, the one who is not actually trying to have the baby. Um, that piece of infertility can often be trivialized and they're disenfranchised. And there's actually a term, disenfranchised grief, which is mean it's a grief that's not validated in society. Um, and we can look at that by, let's say you go to an event and someone comes up to your partner and says, "Oh, tell me about your wife, or tell me about your partner. How is she doing? How are things going?" And uh, completely skipping over the fact that that partner is also equally affected. So this disenfranchised grief can really cause some complicated feelings within your partner, and a complicated experience. And it's just really important to acknowledge that. Um, finances. It is a huge strain, especially when your insurance doesn't cover infertility treatment. And you're constantly having to work with codes, right, to try to get something covered, and trying to figure out, okay, where are we going to sacrifice as a family? Are we going to give up part of our retirement? Are we going to give up this family vacation? And when you have living children, like, how much am I allowing our finances to affect our living children? So, in order to pay for this fertility and treatments. So that is really, really hard. And then also compound trauma equals compound triggers. So you as one partner, you're going to be experiencing a certain set of triggers that's constantly going to be triggering that reproductive trauma. And your partner is also going to be experiencing different triggers. And so um, both of you having that trauma and having those sometimes differing triggers can just be a lot to balance and to acknowledge and to work through. As I was doing research for my book, I had just sort of a cohort of men who shared their experiences of going through loss and infertility. And one of the key components that I just heard over and over again was this feeling of loneliness from the partner, that they weren't validated, they weren't seen. And so, I wrote this because so often the men wrote to me and said, like, this is what I'm doing, but nobody knows. Nobody knows that I'm going into a closet at work or the bathroom at work and crying, or that I'm crying my entire way to work and back. So I just, for any partner that's on here, I just want to say, if you think you're the only man or partner who breaks down in tears at work, you are not alone. If you think you're the only man who is tempted to check out from your grief, you're not alone. If you think you're the only man who felt rage for years, you are not alone. If you think you're the only one who looks stoic on the outside but is crying inside for someone to care, you're not alone. Okay, let's talk briefly about problems in parenting living children. There is a grief sometimes in your child who is asking for a living sibling, and the grief inside of you that you as a parent cannot provide uh, for your child a living sibling, or that you cannot create the family that you always envisioned having. And so I remember one time my daughter, when she was 4 years old, she came up to me and she goes, "Mom, can we please move houses?" And I was like, "Well, we don't really need to move houses. Why are you asking?" And she says, "Well, I just want to move to a house, where there's other people there, so that I can have sisters and brothers." And my poor daughter, she thought that the problem with us not having more kids was with our house, and not in my body. And obviously that just cut me to the core, because my 4-year-old was sort of wrestling with not only, she grieved in her own way the loss of our ectopic baby Olivia, because she was really excited about the pregnancy. Um, but then also this loss of, like, I want siblings, and I can't have them. And that's really hard as a parent. There's a grief many times for your child if you've had a perinatal loss, or loss of child, the grief of your living children, who's missing their sibling. And that can even be the child who has come after the perinatal loss can miss that sibling and have grief. They'll often grieve that. There's triggers from people and places you go while you're parenting. So if you have a living child, you're constantly going to parks, play groups, school events, churches. You're seeing other friends who are also in this stage of life going on and having more pregnancies. And so it's really difficult because you can't always extract yourself and protect yourself from these triggers. Um, like I said, you kind of feel like that walking, breathing, living contradiction of like, okay, yes, I am mothering a parent or parenting a living child, but at the same time, I can't have more children, and that's very difficult. You're also trying to balance your own grief and this own focus on trying again while simultaneously staying present with your child and not missing out on the milestones and missing out on your relationship with them. Um, so also there's just this potential of oh gosh, it's hard to see. I don't know if I can move this. I can't see the bottom. Okay, I'm gonna skip it because I can't see my note there. Okay, let's talk about the stress of trying to conceive. There's difficulty of figuring out when to stop. We talked about that. Financial costs, having to decide how long to pursue treatment, the timed sex, and the physical strain of repeat pregnancies and the treatment side effects. That's a very real factor. The fact that if you are getting pregnant or you're going through hormonal treatment, this affects you physically, emotionally, mentally, and that it's kind of like an earthquake in the sense that it's like it starts with the epicenter, you, right? It's affecting your body, but there's these ripples of effect that cause a change or can cause a strain on other areas of your life. Your relationship to yourself, there's multiple reproductive traumas happening, and there's that feeling of chronic disappointment. There can be a struggle to stay present and not have that tunnel focus. It's a challenge to your identity at times. I remember thinking I was not so much a person who couldn't have a baby as much as I was a person who didn't deserve to have a baby. And I don't know when that shift happened for me. And it doesn't happen for everyone. And I hope it doesn't happen for you, but it can. Infertility can somehow become a part of our identity and of who we are. There is an increased risk of mental health disorders, and this is really hard and really complicated, but anytime you get pregnant or you have pregnancy hormones in your body and they suddenly fall, as though, if you were giving birth, or if you were having a miscarriage, that hormonal shift, it's the same no matter whether you're 4 weeks pregnant or whether you're 40 weeks pregnant. The impact of those hormones on your brain and causing a higher potential for depression and anxiety, and PTSD and that kind of thing. So it's just something to be aware of and talk to your provider about. Decision fatigue, and regret. I said, I don't remember when the bitterness set in. Why does she get to keep her baby? I thought when a woman with a burgeoning belly walked by. Sorry. These are my thoughts when a woman with a burgeoning belly walked by. Or saw pregnancy announcements. They sparked deep-seated anger that life or God was unfair. I did all the right things to try to be healthy and to have a baby, but my pregnancies kept ending in loss. I became jealous, busy, bitter, and resentful. Society often smears these emotions with shame. For some reason, they can be hard to admit lest they reflect a poor character or a spiritual deficit. But instead of judging these feelings, we can recognize they reveal an unmet need. Jealousy, bitterness, and resentment do not mean that there is something wrong with you. It just means there is something wrong. So how can we cope with secondary infertility? First, we can learn how to handle some trauma triggers. Things like having a plan. If you are going into, say, a baby shower, before you get to that baby shower, think through what parts of this are going to be hard for me, and is there any way that I can navigate that? One of the things that I found helped me was to stay busy if I was going to go to a baby shower, and I would volunteer for like all the things so that I could distract myself from thinking about my own experience. And I didn't actually have to emotionally engage with what was going on. I could just keep completely distracted and look like I was involved, but I was just really thinking about getting all the food out or the decorations or that kind of thing. And I'm not saying that's what you need to do, but if you could think of like, okay, these are areas that are going to be hard for me. So what can I do? How can I pre-decide? Um, Establishing your limits, talking about that with your partner, perhaps with a therapist. Um, Employing professional tools like support groups, a licensed counselor or therapist. Um, Also, getting support and helping your child grieve. So, this infertility affects the whole family, right? So, we need to extend the support, the supportive community, um, to all of our family members, and not just to the one who is trying to get pregnant. Finding the right social support for you is really key in your own healing. And that can be really hard. And it might not come from the places that you expect. But finding the people and the support groups that are right for you, and it can take time and you have to be patient, but it is possible to find that. Before we go into a Q&A, I want to just go over some affirmations that I think is important for all of us to keep in mind. So if you'd like to write these down, you can. I know you guys will be getting a recording of this, and so if any of these affirmations really speak to you, then I would encourage you just to write them out and put them on a mirror someplace that you can see them all the time. So things that we need to keep in mind. And I'm going to use first person I, and I just want you to see this as for you. I am worthy of tender care. I deserve to heal. I deserve to have my physical needs met with generosity and comfort. My body deserves respect. I will not demand more of my body than I have energy for. I will respect what my body tells me it needs. I have a voice that needs to be heard. I will make my boundaries known to others. No one else gets to determine what I am capable of right now. I need rest. I need time away from people, activities, distractions, and yes, time away from thinking about my fertility so that I can rest. Taking care of myself needs to be one of my highest priorities right now. And by taking care of myself, I also mean allowing others in to take care of me. As we conclude, I just want to remind you of your rights, your reproductive rights. I mean, this isn't all of them, but these are ones that I really want you guys just to keep in mind that these are this is what you deserve and this is what you can cling to. You have the right to not care. Okay, so you have the right to not care about other people's experiences, other people's opinions of you, what other people think that you ought to do, or their expectations of you. You have the right to not care. You have the right to ask for help and the right to receive tangible support. You have the right to say no, the right to stop working or change your work, the right to avoid triggers, and the right to ask for accommodations at work. You have the right to stand by the decisions you've made in the past, even if you would make a different decision now. You have the right to simplify your life. You have the right to choose your focus, the right to put up healthy boundaries around those who are unsupportive or unhealthy to your process. You have the right to reject others' timelines for your fertility or your grief, the right to ask for what you need. You have the right to change your mind. You have the right to ask the deep questions in life, even if they challenge long held beliefs. You have the right to be heard, not placated. You have the right to say no or no more, the right to be treated as a whole person by your medical providers, the right to safe medical care no matter your age, gender, sexual preference, or skin color. You have the right to social support and the right to grieve. Okay, I just want to, Kylie, encourage you just to open up the questions. I'm open. I know I'm happy to share any part of my story if anybody has any questions here for us.
I was muted. Um, Would you like to stop sharing so people can see your full face?
Oh, yes. I didn't realize that they couldn't. So let me stop. Okay. Is that better?
Perfect.
Okay.
Yeah, so if you have questions, why don't you use the chat box feature now that it's working? And Rachel, I can read those too if that's helpful.
Yeah, that would be great.
Okay, so someone's asking, are there mental health providers who specialize in these topics? So yeah, why don't you go, and I have some thoughts on that too.
Oh, okay. Just briefly, yes, there are providers who specialize in reproductive trauma, and it is important that you find a provider who does have a background in trauma at the very least. But finding somebody who can specialize in reproductive trauma is great, and you can go online and look up different providers, and they usually list what they sort of specialize in, because a lot of therapists out there have special niche topics. The one thing I would also let you know is that it can be difficult, like when you're talking to your medical provider and they might give you like a depression screening. It can be difficult to delineate what is grief and what is depression. And right now, there isn't a screening that I'm aware of anyway. In doing my research, that helps a medical provider understand, is this depression or is this grief? Because it's just not a separate one. So it's just really important. Um, and it looks like, okay, it looks like you just posted a great link here that has some resources. So go ahead and share, Kylie.
So there is just some more information. There are psychiatrists who are reproductive psychiatrists who are, so that's something. And then there Postpartum Support International has a new certification called PMHC, Perinatal Mental Health Certification. So I put the Return to Zero Hope Pregnancy and Infant Loss Directory, which has one-on-one support. It also has support groups and organizations, all by location. And then also Postpartum Support International has a directory as well. So I'll just put their website there. But it is important that you go to someone who understands this particular issue. So yeah. Okay, another question. What advice do you have for people who are at the point of trying to decide whether to continue trying or conceive or end their journey?
That, I found that is one of the hardest questions to sort of wrestle with and come to a conclusion with, because it's so emotionally fraught, and the long-term consequences, it's sort of like a consequence that affects the rest of your life. And so that is going to feel like a really hard question. um, for pregnancy loss, I mean, just my doctor told me, she's like, don't think about how many losses, can I handle 5 more losses, or how many. She's like, don't project out. Just look at right now. Right now, can you handle one more loss? And that is how I had to choose for myself. Can I handle one more? Can I handle one more pregnancy? And I think that you can really extrapolate that out to infertility treatments and tests. Can I handle the next step? What the next step is? Can I handle that next surgery? Can my body handle it? Can I emotionally handle it? Will my relationship handle the strain of that? And so I think it's to make that decision, it's you kind of have to narrow your focus instead of trying to look at the entire, rest of your life. Look at like right now, because right now is all you can control. So what is it right now that is next, and the next step, and is that something that you are ready to take on? Kylie, I don't know if you have some better advice there.
I think that's really good. Yeah. And it's hard because it's, on one hand, your body may be physically able to do it, but you cannot emotionally do it. And so, I mean, I think that those two things, you do have to look at the whole picture of who you are at that moment.
Absolutely. Yeah. And honestly, your emotional self is just as important as your physical self. So honoring and recognizing the needs of who you are as a person, mentally and emotionally and spiritually, all the other pieces of yourself, those are equally important as what your body is capable of.
Yeah. Are there any other questions for Rachel?
I saw a question here. Is it possible to get a copy of the webinar slides? I would be happy to send those. So Kylie, if I sent you the link for that, could you just put that out in the email?
Yes.
Okay, perfect.
Thank you.
I'm just trying to go up here through the comments. Other than allowing space, what other advice do you have for therapists helping clients? Okay, so I have to start by saying I am not a licensed therapist. So I can give you my advice as from the patient side of it. I think holding space is absolutely important. One of the things that my therapist did for me was to help take the ambiguity of my loss and help make it more concrete. So when I was grieving our baby Olivia, it was really difficult because I was like, okay, well, I'm wrestling with the fact that I didn't get to see my baby, I didn't get to hold my baby, I don't have ultrasounds of heartbeats. So this, it felt so ambiguous, and also nobody else saw, nobody else felt the pregnancy symptoms, nobody saw my belly burgeoning. So there was this, it was very easy for everyone around me to forget that I was even pregnant, right? Because it wasn't a change necessarily for them. And what she helped me do is she says, you need to let this baby and this pregnancy be what you expected it to be, what you hoped it to be. And so she encouraged me to name my baby. And I didn't have to do that for every pregnancy, but just helping take that ambiguity out of it and helping me really focus on okay, what am I grieving? Helping me name the things that I lost, and name the things that I need to work through. And then I know that, this is, I know you already know this, but just the trauma piece of it, helping the person you're working with navigate what are trauma triggers, and how do I know when I've been triggered, and how can I recognize trauma within my body, and then what kind of tools can I employ in the moment to be able to navigate life, and to be able to get through those moments without it being complete, without me being a complete emotional mess. So Kylie, I don't know if you have anything you'd like to add there to that. That's really important for providers to know or think about. Oh, I think you're muted. There you go.
I was just saying, not anything off the top of my head.
Okay.
More. I put some more resources for support groups and support in the chat. So I'm gonna say, okay, Allie's talking about insurance, but I will say for therapists and psychiatrists who specialize in reproductive perinatal mental health, most do not accept insurance. They're going to be out of pocket. Mm-hmm. And you, well, Allison is saying, okay, that you do, Oh, and Allison, you're only actually sharing that with me and Rachel, not with everybody. So there are some PMHCs who take insurance, but I've just like where I live in Los Angeles, there's none or very little, but Allison, do you want to message Allie? Yeah, I think when you in the to field, Allison, it says host and panelists, you can change that to say everyone.
Real quick, I just wanted to address something I saw here in the comments, and I didn't actually talk about this, but this pressure to look at the other means of adding to your family, this concept of, well, you should just adopt. Like there's all these waiting babies out there that need parents, and you're a parent who wants to adopt, so or your child. So why don't you just adopt? It's always that, as though it's easy. And I can tell you, as an adoptive parent, and as a foster parent, it is just as complicated as, or maybe even more complicated in some ways, as giving birth. And so it's not this simple equation. It's not this simple solution. And really, like, adoption is not secondary to having a biological child, and having a biological child is not secondary to adopting. So they're different experiences. The one thing that I think is really important that every person considers before they talk about adoption or fostering or any other way of expanding your family and alternate means is recognizing that when any child, even if that child came directly from the womb of another woman directly into your arms, that child has experienced trauma. And that child will experience trauma for the rest of their life. And that doesn't mean that your love is not wonderful. But it does mean that you need to recognize that you are a traumatized individual who is now going to take on another traumatized individual. So you have to take care of your own trauma. You have to work through that in order to be able to help someone else through theirs, because their trauma can be really triggering to yours, right? So you have to have this awareness. And to be honest, there is a portion of the fact that, like, you have lost control of your family. You have lost control, or potentially lost a child. So you can relate to that child that you've adopted or you're fostering in a way, because you can recognize, okay, they've lost control. They've lost part of their family. They are grieving the family they don't know. And so in some ways, it's an advantage that you can relate to them. But also, again, you have to be in a healthy place in order to be able to help that child through their trauma. So simply wanting a child and simply loving a child is not enough. If that makes sense. So I hope that helps.
Thanks, Rachel. So I want to thank Rachel. Thank you again for being here, for showing up and sharing your experience and all of this hard-earned wisdom with us.
Thank you for having me. I appreciate it. I really hope it was helpful for people.
And thank you to those of you who are able to be here and join us today, or who are going to join us virtually. Our hearts are with you for those of you who are going through this. So thank you.